Good day. My name is Mikey Gittins, and today I will be talking about dengue fever. Now, dengue fever is the most common mosquito-borne viral illness in the world. It is transmitted via a mosquito called the Aedes aegypti, and it's usually the female mosquito that bites and transmits these viruses. This mosquito can be identified by the white bands or scale patterns on its legs and thorax. This mosquito also transmits other diseases such as chikungunya, yellow fever, or Zika. These mosquitoes usually feed during the daytime, usually at dusk and dawn, and they breed or multiply in clean, stagnant water, like outside in your flower pots or in a clogged drain or in just a stagnant bucket that you have outside collecting water. This has become a major public health challenge in the tropics and subtropic nations, as you can see highlighted in the blue on the map on the side here. Widespread infections are seen during the rainy season, since this is when humidity and temperature is the most conducive for the survival and breeding of these mosquitoes. However, it has been started to, incidence of dengue fever has started to become more prominent in other parts of the world, apart from the tropical and subtropic nations, due to global warming and frequent air travel between countries. So the transmission of dengue fever is usually between mosquitoes and humans. An infected mosquito would bite an uninfected human, which would then incubate the virus, and then an uninfected mosquito would then bite the infected human, and then the cycle just keeps going on now. So this is just a little schematic showing the period of the transmission of the disease. So it starts with the mosquito, and then the infected human proliferates the virus within its blood. So that's called viremia, which means the virus is in the blood of the infected human. That lasts about 5 days, as you can see here. So during the time of viremia, the mosquito can then, that's when it's a perfect time for the mosquito to bite the human and then transfer it. Symptoms of dengue fever usually last between 3 to 10 days. So it can last longer than the period of viremia. So signs and symptoms of dengue fever. So dengue fever is a severe flu-like illness that can infect all ages, all ethnic groups. You can have mild dengue fever and severe dengue fever. So dengue fever should be suspected when you have a high fever, 40 degrees Celsius or 104 degrees Fahrenheit. So you must have this high fever and any other 2 symptoms such as severe headaches, pain behind your eyes, muscle and joint pains, nausea, vomiting, or you can have swollen glands. In the severe dengue fever, it's a deadly complication. The virus can damage your blood vessels and cause bleeding. So you can have severe bleeding, severe pain in the stomach. Your blood pressure drops because of the damage to your blood vessels. So that would also affect your heart, your lungs, your liver. So you would have trouble breathing, and you can also appreciate bruising under the skin. So, so high-risk groups. This virus can affect all ages groups and age groups and racial groups, like I said before. But you can be at a higher risk if you are living or traveling to tropical areas, or if you have been infected with dengue fever before. You're more prone to a severe infection. So there is a vaccine called Dengvaxia. It was approved in 2016 for ages 9 to 45 individuals who live in high-risk areas, such as the Caribbean and Africa and such parts of Asia. This vaccine is given in 3 doses over a period of a year. But the best preventative strategies for dengue fever is shown in this little schematic here. You need to always cover your containers or use insecticides in stagnant water, or even put little fishes in stagnant water. That helps get rid of the larvae, the mosquito eggs. You need to throw away all water containers. Anything that can collect water, throw them out if you don't need them. Unclog drains, because clogged drains can cause accumulation of water, and accumulation of water and stagnant water is a conducive place for breeding of mosquitoes. Mosquito repellents are also a good strategy. Even light colors, because mosquitoes are drawn to dark black colors. Also, there's nets that you can cover your beds with or your children's cribs, and close your windows, or even purchase nets. There are nets that you can put in your windows to keep the mosquitoes out. So there are no specific treatment for dengue fever other than the supportive measures, such as using painkillers for the relief of your joint pains. However, you should not use any painkillers with aspirin in it, as this can cause bleeding. So if you have the severe disease, which damages your blood vessels, using aspirin would make a disastrous case. Okay, and that is it. I hope you learned a lot more information on dengue. And thanks for watching.